Let's get some reaction on the Health Ministry reshuffle. We're now joined via Zoom by Anele Yawa, who's with the Treatment Action Campaign as their General Secretary. Thank you so much indeed for joining us and welcome to the programme. Hello, Mr. Yawa. If you could just click audio, unmute.
Okay.
On your... There you go.
Greetings to you, Peter, and the viewers at home, and thanks for having us.
All right. So, as Treatment Action Campaign, are you happy with the new minister?
It's not a question of us being happy or not. It's not a question of change of personalities. If the new minister, Minister Joe Phaahla, is willing and committed to fix all the problems that we have within our public healthcare system, then we will be happy to work with him. But if he is going to continue giving promises to people without any changes on the ground, then we're going to have a problem. So for us, it's not about who is the minister. It's all about which minister can deliver on the mandate of serving the people of our country.
Do you think that there will be changes? The ANC is very good at continuity unless there's a serious change of administration within the party. So I suppose a lot of people will be thinking it's much more of the same kinds of things. And how do you feel about that?
As much as I didn't hear you clearly because there is a noise on your background, but I think from where we are seated, as TAC, we believe that one of the problems that we have in our country is a lack of political leadership, commitment, and a political will. You will remember that the reason that in South Africa we've got a broken public healthcare system is not because we don't have money, but it's because of ANC cadres who are deployed either as ministers or as officials who continuously loot from the public purse, and their looting is compromising millions and millions of people of South Africa. So all what we are calling for from the ANC, they must make sure that their leaders who are implicated in corruption of looting within the public purse, like Minister Zweli, Mkhize, Brian Hlongwa, I'm sure you know in Free State, the former HOD, Dr. Motau is implicated in corruption. These are the people who are delaying progress on the ground. ANC must get rid of all these corrupt people because they are failing the people. And if ANC is unable to remove its own employees who are corrupt, then it means ANC must be removed as the government.
All right. So what do you want Minister Phaahla to do immediately?
What we want to do, the minister to do immediately, firstly, we expect the minister to set up an anti-corruption unit within his department as a matter of urgency in order for him to ensure that not a single cent that is being looted by these corrupt officials within the department. We will wish the minister to ensure that he pays more attention on human resource for health because we don't have enough healthcare workers. Many of them succumbed due to COVID-19. Also, we will expect the new minister to focus on issues of infrastructure. Our clinics are collapsing. Most of them were built as early as 1943, and we cannot allow a situation where people are overcrowded in our clinics that are small. We would like the new minister also to focus on how are we going to ensure that no one leaves facilities without having medicines, and then the rest can follow.
And are you happy with the current COVID-19 plan, or do you think that he has an opportunity also to shift direction a bit?
Unfortunately, most of the time, Peter, all these things, when they are written on paper, they look good. But when you go on the ground, you don't see the full implementation of what is on the paper. So as they say in English, it is easily said than done. The plan can look beautiful on the paper, but if it does not address all the things that it said it is going to address, then it's equal to a useless plan. All what we want now is we are saying to our government, stop paying lip service. Go on the ground, deliver on the mandate that you have promised the people of South Africa that you're going to deliver for them. So we are tired of lip service. That's why tomorrow, as TAC in Gauteng, we are visiting Premier David Makhura. We didn't apply for that match. We are going to Premier David Makhura to raise issues about what is happening in Gauteng. And we are clear that we are not going to apply for the match. If the government of South Africa wants to arrest us tomorrow in Gauteng, they must arrest us. Because when these leaders loot and they do all these promises to our people, they don't apply for permission. When about David Makhura and others come to our communities and want us to vote for them, they don't apply. So we are not going to apply, but we are clear. We want David Makhura and the MEC officials of Gauteng to meet with us. They must tell the police to back off because they were never voted by the police. They were voted by us. We want answers now.
But you know that these marches are super spreader events. How are you going to manage that?
Firstly, we are health activists. We are going to observe social distancing. But also, put Peter, to be honest with you, we saw on many occasions during the lockdown, we saw that after we were told to stay at home, many wrong things happened on the ground. So as activists, we are going to observe social distancing, we're going to wear masks, and then all what we want answers, because we cannot keep being locked indoors while things are falling apart on the ground. People are dying on the ground, and the leaders are not providing leadership. That's why now we are deciding to take it to the streets.